Turning now to the Omicron surge of COVID-19, cases have been skyrocketing in Oregon since the end of December, but the state may only have to endure a few more tough weeks of this wave.
And that's encouraging news. Fox 12's Kendra Kent is live in Hillsborough tonight, gathering perspective from healthcare workers and researchers tracking COVID. Kendra?
Yeah, Nora, that's right. And right now, it really is too soon to say whether we are at the height of the variant or if perhaps that's going to be just a few days away. Of course, the data is always a little bit further behind. Now, add in the fact that so many positive tests aren't even being reported right now, and that muddies things further. But hospitals and your toilet do hold some answers.
We have limited the amount of surgeries that we do.
We've heard that before, and here we are again.
In order to keep people from being hospitalized.
That's nurse Nicholas Ng as we hit mid-January, smack dab in the middle of an extraordinary surge of COVID, with Omicron making its rounds in record speed. But is the end near? It's the highly anticipated question, as Oregon public health leaders have predicted the state will hit the peak of the Omicron surge by the end of January, and perhaps as soon as this week. Whether that's the case, only time and more data collections will tell. But in Washington County, some experts believe COVID cases are still climbing.
According to wastewater, we haven't hit our peak yet. But honestly, I'm not that surprised because Oregon has been a little bit behind in our Omicron surge compared to other states.
Clean Water Services has been tracking COVID-19 in wastewater since the beginning of the pandemic, taking 2 samples weekly from human waste to analyze. And while COVID-19 tests are hard to come by, everyone still goes to the bathroom and thus submits their sample.
Nowadays, with everyone taking so many home tests and a lot of those not even getting reported to OHA, wastewater is in a lot of ways a more reliable indicator of what's really going on out there than the reported case numbers.
Another indicator, hospital capacity. As you've probably heard, they're full and COVID cases are everywhere.
More patients who are COVID positive are requiring surgery at this point in time. Emergency surgery, things that have to happen. I'm seeing that more than I've seen it in this pandemic.
A tough line of work when the finish line is always moving, but maybe at least a break is on the horizon.
I sure hope we get over this soon. I want a vacation.
The Oregon Association of Hospitals and Health Systems is going to be holding a press conference tomorrow. There we do expect to learn more about the forecasting of the peak of the surge, as well as how hospitals are making final preparations for the peak. We will, of course, keep you posted and have more details on that when we get them. Reporting live tonight in Hillsborough, Kendra Kent, Fox 12 Oregon.
All right, Kendra, thank you. Here's a look at the numbers. Today, the Oregon Health Authority reported more than 8,500 new cases of COVID-19. This graph shows daily case data over the last 6 weeks. As you can see, there was a sharp rise in late December, and that has flattened out in the last week. Oregon currently has 921 patients in the hospital with COVID-19. That's 10 more than yesterday. That number is about 22% below the record high that came during the Delta surge.